Hey, it's Ed here. In the healthcare industry, they're saying that we're about 50,000 doctors short right now. And by the year 2025, we're going to be 120,000 doctors short. And by the year 2020 or 2030, we're going to be 1.2 million healthcare workers short. So that's doctors, nurses, counselors, the people that take your blood when you go in to just have a checkup. So we're in a real crisis, and unfortunately, to get your degree, you're going to spend $35,000 to become a counselor. That's what your debt is going to be when you get out of college on average, and you're going to make about $40,000 a year. Now, the healthcare industry is suffering, but the substance abuse industry has hit the hardest. The burnout rate is 1 in 4 leave every year. And we're not even keeping up with the demand, let alone the people that are leaving, the attrition rate. So many of these treatment facilities are actually understaffed. And what that means is they can't fill all the beds that they have. So when SAMHSA says that 1 in 10 who need treatment get it, that's part of the reason. Part of the reason is cost. They don't have access. They don't have the insurance or the money to pay for good treatment. So, there's a lot of factors why people don't get treatment. And you talk to people on the street and they say, oh, there's a treatment facility on every corner. Well, no, there's not. There's not a treatment facility on every corner that can take 90% of the people who need treatment. So we need to change the industry. It's become a factory. We're treating people for 28 days, and it's just a revolving door. Those same people are back 2 months later, 6 months later, a year later. And how many times do we have to treat the same person? 9, 10, 20 times? And who's paying for that? If we don't have the capacity, we need to provide better treatment so we can increase the capacity and not continually having this revolving door. How do we increase the capacity? By better tools. We're trying to treat people with a 21st century problem with the drugs that we have today with tools that were developed 50 years ago. The 28-day program was for the GIs coming back on leave from Vietnam addicted to heroin. They knew that they needed to get them cleaned up and back to active duty before their leave ran out. So that's 28 days. It's not enough. It takes a long time to rewire that brain. That's why you're seeing so many people relapse. And when people relapse, they die because they think that they can use the same amount of drugs that they started with or that they were using before they went into rehab. And now they come out and they try to use that amount, and it kills them. And Narcan isn't the answer. It's a tool. Suboxone is not the answer. It's a tool. We need treatment. We need long-term treatment. And you'll hear me say that over and over and over.